Welcome back to the Pulse. Now, there's been an increase in the number of positive cases of rabies in dogs which bit people in Ghana this year. It rose from 56% last year to more than 64%. Majority of those cases were reported in Accra. Our research desk breaks down the figures further for us, and I'll take you through that shortly. Now, this is the total number of cases recorded as at August. And so we have 31 total number of cases recorded. Out of that, we have 20 as positive cases, which represents 64.5%. Negative cases, which is 11, representing 35.5%. And 83.9% of the cases are cases which occurred in Greater Accra. Now let's look at this, which is also the one that was reported at the veterinary laboratory in Accra. Total number of the cases recorded 46 here. You have 26% out of the 46 turning out to be positive cases, which represent 56.5%. 20 of the cases negative, which represent 43.5%, and you have 91.3% of all the cases occurring in Greater Accra. Now, you come back to the laboratories and you look at the total number of cases that went to the laboratories. There are 41. 25 out of that came out as positive, which represents 61%. 19 came out negative, which represents 39%. And 63.4% of all those cases also occurred in Greater Accra. Now, there's underreporting of cases across the country due to a lot of public people in the public not being aware of what to do. At least that's what research has shown. There's also late diagnosis at some medical facilities. That is why we'll be having a conversation on this. And joining me for that conversation is Dr. Benjamin Kisi-Sesu, who is with the Risk Communication Team of the Veterinary Services Department of the Ministry of Food and Agriculture. First, how did we get here as a country?
Good afternoon to all your viewers. It's so sad that we have gotten to this situation. And before we get to the statistics we gave, globally, according to World Health Organization, 59,000 lives are lost due to rabies every year. And when we do the statistics calculation, means daily we are losing 144 lives every day across the globe. And out of these 59,000, more than 70% deaths are recorded from Africa. And even Africa, there's more of underreporting. Even if we see what the statistics we just had from Accra Veterinary Lab, that's more of the testing. So a lot of people do not report. We could find out later that people have died, and later when the samples are brought from humans, they get to know that people do not report. A lot of people die without reports being taking place. Just last month, we had a life lost in the Central Region. A lady who is under 15 years, a life was lost due to rabies. Yesterday, we had Pong Katamanso because two people died due to rabies. One be a pregnant person and one be a child. And people have been taking this for a joke. And as we were last year, there was a whole document signed about ending rabies 2030. We are joining the World Organization, other countries, to say that by 2030 we want to eradicate rabies in Ghana. But looking at the statistics, it seems much more work needs to be done. And if you look at this year's statistics, the reporting is up to August, and we are just have 31 cases so far, and out of it that we have 64.5%. And if you realize in this cases, a lot of them are from Greater Accra. But ask yourself, what about the other regions? Are they really reporting? Because last year we went to Upper West to do a rabies campaign. I realized that a lot of people do not report. They go by tradition to find their method. Some have not really understand rabies as it is. And most of the rural areas, people are using them for hunting, are used for a lot of purposes. And when they get a bite and scratch, some people don't report to the hospitals for them to get to know. These are issues of greater concern. That each year, especially in September, we do take the opportunity to advise that everyone should check whether his or a dog is vaccinated. You realize that 99% of all human rabies are coming from dogs. So in September, we do make a lot of noise, which the media have been helping, which JoyNews have been helping us every year to make this noise. So the situation is not kind of improving. This is what has been recorded. We are looking at what has not been recorded too. It's also a big issue to talk about. So it's a greater concern, which we have to let the public to know that anytime that you get bitten or you get a scratch, whether it be a puppy, there's one thing that people should know. When it means a puppy, people don't report at all. If you get a scratch from a puppy, for any type, just report to the nearest so the situation is put under control. But in your own house or wherever you find yourself, if you're walking around, whenever you are bitten or you get a scratch from a dog, just get a running water and wash under running water for at least 5 to 10 minutes. You could sing A, B, C, D, or can sing a song and make sure you wash. After that, you get to the nearest health facility. Most people, after a scratch, after a dog bite, just normally look at the dog and say, "Oh, this is a puppy," and they don't mind.
So why is it that more dogs are getting the rabies now, and they in turn infect the human beings through biting?
Yes, globally, as I said, 99% of the human rabies are coming from dogs, and we can stop this thing 100%. Rabies is preventable, 100% preventable when we do vaccination. 10 to 20 years ago, Ghana had a free rabies campaign, which was ongoing. But due to different successive governments, currently we don't have this campaign going on. Now people are left to do their own vaccination, and people are not being of consent, and this is happening. So I think last 2 years, Kasa also had a share of a lot of rabies outbreak there, and people went in to do free rabies vaccination. The goal is to make sure we get our pets vaccinated every year. If we do it continuously and we vaccinate about 70%, we are good to go that by 2030 we could eradicate it. If not, we'll still have it because there are still stray dogs always around. As we walk around the street, you see dogs moving around, and this is a greater concern. And this doctor will always say, have owners, because these dogs in the night go back to their owners. So we also ask that every owner should be responsible. Be responsible by make sure provide shelter. Don't leave your dogs out anyhow, and people should respect signs that are put in front of people's building. Don't just enter somebody's building when it says beware of dog, because when you enter somebody's territory whereby the dogs are there for security purpose, you'll be in trouble. And you have even some of the cases where provoked bite. Some children normally would like to throw stones or hit the dog's with stick, and the dog in defense would attack. And in all these things, this year's theme is rabies, fact but not fear. We always, when we do here, people get frightened. But this time around, I think that there are factors we should know. 1, rabies is 100% preventable by vaccination. 2, it's 100% fatal. Once you get bitten, signs begin to develop in human. There's nothing that we could do. You would just lose your life. And many health facilities who have encountered this situation would let you know. We also want to let us know that 2/3 of the world still have rabies in their country, and Ghana is part of it. But some countries are be able to eradicate it, and we could also do it as we put on our long-term plan.
And I'm happy you talk about eradication. And yesterday was World Rabies Day. As you celebrated that day, what are the new strategies you intend to introduce to deal with this?
Okay, I think last year, though there was COVID, which made everything a little bit down, and awareness was a little bit down. Last year, the government, the Ministry of Health, the Ministry of Food and Agriculture, they signed a 10-year long plan, which is being rolled up. It's the guide for us to create awareness and also to end. And they have stated all these things, which we are hoping the various ministries will put into practice, especially with the free rabies vaccination that we are still advocating for. Some assemblies are doing well, and their budget some money down. Like yesterday, in Pongo Tamasu, that we hosted the World Rabies Day, they, for now, after the target to do 6,000 vaccination in their municipality, which is yesterday, as we were on ground, a lot of people did patronize it. Yesterday one was for free. Some of the places said they would do it for subsidized prices as low as 5 cities. And across the country, other regions are also creating awareness and are letting people to come, and they are doing a subsidized. Some are going to get support. But the plan, what we are wishing to do is government to adopt a policy whereby we could do the free rabies vaccination across the country. If we are able to do it for more than at least 5 years, we cover 70%, we will be good to go. If not, by 2030, and countries are reporting for them to get checks to see whether we have had rabies eradicated. I don't think Ghana will be named as one. And if you look at the statistics, it means we still have rabies among us. And just as I said last month, a life was lost. More work needs to be done. And we would ask that various bad bodies, NGOs, society, media, to help us make this, dumb this message down, so we could get their support. So by 2030, we could be free. It's so sad. Maybe some have not seen people dying. It's a shameful bet. See a human being dying, whereby he's struggling like an animal. Some backs, some having during saliva, they become so aggressive, they have been tied to buildings. If you meet some health personnel who have encountered this thing at the facility, the person is even locked up in a room to die. Nothing could be done. It's so bad. So most people, when they are relative or friend die through this, they don't tell people, and they don't do organized funerals. They tell people that they have traveled outside of the country. Within 4 years, I've met people who have lost loved ones, and they have told people that the people have traveled outside the country, because it's very shameful. It's so.
I'm grateful for your time. Dr. Benjamin Kisiseso is with the veterinary services. He says a lot more is being done to deal with rabies infections, but he says the public must be educated that it still exists, and we must do a lot to also protect ourselves.